As a third wave continues to create havoc, particularly in the Gauteng province, some hospitals are starting to transfer patients to other facilities. Health authorities have warned that the country's healthcare system is under severe pressure as admissions grow rapidly. To discuss the situation, I'm joined now by Professor Francois Venter, infectious disease expert. Professor Venter, very good morning. Thank you for speaking to us. Now, ahead of the President's speech tonight, suggestions are that further restrictions will be instituted. Is this the best way of dealing with the current situation?
It's far too late for any further restrictions, to my mind. It's the only restrictions should be the ones that should have been in place since March last year, which is the usual stuff. Avoid indoor gatherings, and if you can't, wear a mask. Unfortunately, we are in so much trouble. It's difficult to convey how much trouble Gauteng is, but many of the other provinces are starting to look quite scary as well, the Western Cape included. But Gauteng at this point is a catastrophe. And just to add to what you said, we were starting to get reports yesterday of people actually transferring patients to other provinces, to KwaZulu-Natal, because the Gauteng facilities are not able to cope.
Now, so how do we deal with it if there are no vaccines currently? And obviously, you suggest that further restrictions will not offer us any assistance.
Government must focus on the absolute essentials at this stage, which is to maintain the supply lines to the health facilities. Everything, ambulances, oxygen, medical staff, you name it. That's what they must focus on. Stop distracting us with this other thing. And the public needs to be angry, to ask, why are we unvaccinated? Why are we, at the rate we're going, we're going to hit a fourth wave with most of the vulnerable not vaccinated. So, the public can do their bit by staying indoors, by staying behind closed doors and observing the restrictions, trying not to get sick, not burden the health facilities with stuff they don't need to. But they also need to be activists. They need to be saying, we need these vaccines. The only way we're going to get back to normal and not have these kind of dreadful impacts on the health system and on our communities is for us to get vaccinated.
Now, all I've heard, and certainly most of us, are excuses, certainly from government. What didn't they do that they should have done?
There are so many missteps here. Instead of lockdown law, 4 or 5, goodness knows what, we should have had an education program that went to the taxi drivers, went to the restaurant owners, the bar owners, to schools and explained why they need to socially distance, why they need to open windows, why they need to use masks. Nobody is invested in killing people in this epidemic, but there was no real attempt to educate people. Instead, it was just laws, but more laws, and this kind of lockdown mentality that this somehow is how you're going to get buy-in. And at the same time, they violated public trust. We saw between the corruption and then, you're not allowed to go to parties and bars, which seems like a really sensible thing, but at the same time, you can fill churches. Just, it doesn't make sense. So when you start doing that, you mess with public trust. At the same time, the thing that they're really entrusted with, which is acquiring and distributing vaccines, as you say, has been just one set of continual missteps and excuses. When we started the vaccine program, we needed to be doing about 150, 180,000 vaccines a day to get anywhere near the targets that government promised us. We're starting to head to 250,000 a day because we are so behind. Almost no old people are vaccinated. No one under the age of 60 with a comorbidity is vaccinated. And a handful of healthcare workers, teachers, and a small number of old people are vaccinated.
Now, Professor, almost a month ago, we were reporting that India was recording at a peak almost 400,000 cases a day. They're down to 66,000, which is still high, but a significant reduction. Now, one of the things that their Prime Minister said a few days ago was the NGOs and other third parties need to get involved in the vaccination process. And up front, government has continually said that they hold the rights to importing vaccines. Should this change?
I think that there is something to be said for government having some oversight of this process. Otherwise, just rich people are going to get vaccinated and the poor will be left behind. Although, to be fair, that's pretty much what's happening anyway underneath government's watch, is that people in urban areas and people who are connected are the ones who are getting vaccinated, who know how to game the system. So I do worry around equity, that, people sitting in informal settlements are not going to get vaccinated while people in rich areas are. So there is something to be said for that equity argument. Having said that, government needs to open up the vaccination process. It's bureaucratized this to the point, a friend of mine called it, to the point of paralysis. This onerous registration process, people should be able to walk into a facility and get it. We've got amazing reach with pharmacies, private pharmacies across the country. Why can't they just let them get vaccinated? If somebody walks through the door with evidence that they're above a certain case threshold, vaccinate them. I watch these people registering people in old age sort of pension queues. Why not just vaccinate them? Stop with the registration, onerous sort of use of human resources, and just get on with the job.
Now, you talk about rich people getting vaccinated. Is it not better to get vaccinated than just wait for government to do things? Because surely once they get vaccinated, the rich and those that are in positions of being able to collect the vaccination, they're not going to hoard it. Surely it's going to spread to everybody else.
So I hope that does happen. At this point, though, there is, you've seen it across the world. Rich countries get vaccinated, poor countries get the tail end. Africa is so far behind in terms of its, the pharmaceutical companies have sold all their supplies to whoever can afford them. South Africa, unfortunately, even by African standards, has been sort of Johnny-come-lately to the party, and that's part of the reason why we're so far behind. I'm not suggesting people should hesitate to get the vaccine based on all of this, but harsh questions do need to be asked about why is the distribution favoring people who have access, say, for instance, to airtime. That's a certain demographic, and we need to make sure that everyone is safe in this epidemic, not just people who can afford to buy their way out of trouble. And unfortunately, in South Africa, that has been the case, in healthcare in general. Those of us who can afford medical aids are the ones who can step aside from the system and not have to deal with it. But in this case, South Africa really should be showing solidarity and trying to get everyone vaccinated.
Now, the Delta variant is said to be highly transmissible. Explain highly transmissible versus just being transmissible.
So the bad news is that the original one, the first one that hit us in the first wave, was pretty transmissible. The Beta variant, the one that was described here first, was even more transmissible, and now the Delta one is even more transmissible over that. The limited data we have is that, and it really comes from KwaZulu-Natal, is that the Delta variant is now the predominant variant there. We don't have the data for Gauteng yet, which has been the province that's hammered, but almost certainly that is where the Delta variant is accounting for this massive surge in infections that we're seeing there. So it just means, the thing about viruses, they do tend to evolve to becoming more and more transmissible until they hit a sort of critical threshold. The virus has no interest in killing you. It just wants to infect the next person so it can make itself more of itself. And so it's not good news for Gauteng. It does at least explain why we've had this sudden severe surge. It's bad news for the other provinces because it means that some of them may well see the same surge in the Delta virus. The one good news, it's bad news that South Africa is unvaccinated. But the good news is that it does seem that all the vaccines work on all these variants to keep you out of hospital. They don't keep you from getting a little bit sick and a bit fluey and 2 or 3 days in bed, and very occasionally somebody will get severely ill. But the vaccines still seem to work against Delta, Beta, and all the other variants.
And let's talk a little bit about the schools. There's this, excuse the pun, a school of thought that suggests that schools should be closed. What are your thoughts on that?
It's a complex debate. Closing schools has a devastating impact on childhood development. And we don't send kids to school simply to keep them out of their parents' hair. There's such a body of evidence that schooling is such an important part to kids' mental health, their future prospects, everything that means that they're primed for failure if you keep them away from school. So this is not a minor debate. Gauteng Health held a press conference saying it's not circular, it's not schools that are driving the epidemic. And I find that I'd love to see that evidence because I doubt that's true. I think schools are focused. Having said that, I think it is possible for schools to try and make themselves as safe as possible. The problem with schools is actually more who's at home. It's granny at home, it's the sister who has diabetes at home, the domestic worker who has a chronic disease. It's the people in the household who are most at risk. Children, luckily, are actually at very low risk of severe consequences. Not no risk, but very low risk. So the decision to close schools is a very difficult one. To my mind, I would rather focus on trying to get schools as safe as possible and try and keep children there for as long as possible. So
there is that differentiated strategy that basic education is certainly implementing, suggesting that each situation should be treated on its very own merits.
Yes, I think the problem with that is it also displaces responsibility onto the individual schools and the governing boards there to make those decisions. And I don't think government spends enough time explaining the dynamics of the viral transmission. I spend a huge amount of my time with different schools and teachers and headmasters approaching me informally saying, what about this? How do I handle that? And the basics are not hard. It's about trying to police physical distancing, trying to keep the windows open in the classes, even if it is winter, trying to keep the children warm, but, distance. It's not, most of the teachers actually got this very quickly. When I explained it to them, they were like, oh, we can do this, we can do that, but they hadn't had the principles actually explained to them. So I think that it is possible for schools to put in place stuff. It's never going to be perfect, and there's no such thing as risk-free schooling. But I think it is possible to keep the schools open.
Now, what are the challenges that I've picked up? Well, a couple actually. We have Newzroom, the field hospital that was set up at the start of COVID, that is being unused at the moment. Question is why? The response to that in some quarters is that we do not have sufficient medical staff to deal with that. Should there be expats being brought into the country to deal with these issues? What are your thoughts?
You can't just make up medical staff. It takes years and years of us, the trained nurses, doctors, pharmacists, you name it, to radiologists to actually, to provide these services. And I was again watching the Gauteng Command Council and Makura, the Premier, saying, oh, no, we're trying to find new staff. I don't know where these staff are. Having said that, there are currently 280 unemployed doctors from community service who haven't been employed. I have no problem with bringing external resources into the country, but it does need to be asked: is why are we doing this now that we're almost at the peak of the third wave in Gauteng? Why is it now a crisis when we are absolutely backs against the wall? And why are we not using these unemployed doctors within the province? So no, I just smacks of panic-stricken, contingency plans that could have been, sorted out months and months ago. I was watching again the MEC. There was the Command Council in Gauteng was actually showing that the current wave models are exactly what they predicted as their worst case scenario. So they knew this was coming. It was in their models, yet they seem to be caught with their pants down.
Professor, finally, if the President put a call through to you and said, give me a 3-point plan on how to deal with our current situation, what would it be?
I would say stop being distracted by lockdown regulations and just focus on your healthcare facilities. Laser-like, not just the Department of Health. Every aspect of government should be helping here. Part of the problem is I come from the AIDS wars and all the HIV drama that we had in the 2000s. And one of the problems there was it was always a Department of Health problem. This thing needs every aspect of government to be focused on it. They need the supply lines to be guaranteed. We need to be deploying whichever resources government has to try and support the health system at this stage. And everything else is a distraction. And then in tandem, the second probably major point is get the vaccination to the door. Do everything you can to get vaccines through the door. Nicholas Crisp, the person responsible for the Department of Health, said yesterday that we actually have sufficient vaccines. We need to make it as easy as possible. People should be sticking their shoulder out the window of their cars and getting the jab, or out of out of a taxi or something like that. So that we need to sweep away. And finally, the third thing would be just focus on education. Just give people the tools. Everyone is invested in not getting this virus in this country, but they're not being told how to protect themselves as best they can. And there is stuff they can do.
Professor Francois Venter, appreciate your time this morning.